Good evening, Kim. Thanks so much for coming out and being with us this evening. And what an honor it is for the Chamber to award to UCHealth our large nonprofit of the year. So speaking of that, can you share with the audience this evening what's your nonprofit mission for UCHealth?
Absolutely, Debbie. Our mission at UCHealth is to bring medical services and healthcare closer to home, which is so important for us here in our region. So with UCHealth as a system, we have contributed $854 million in community benefit, and of that, $359 million was in uncompensated care. And I know that's huge.
That's huge.
It is huge. And so what we want to do is improve lives, bring expanded services closer to home. And that's what we do is we do community needs assessments, and then we determine what areas to focus on. So this year, we have 4 areas of focus. It would be suicide prevention, the opioid abuse, cardiovascular education, and then just access to care, which is going to be great for us up here.
So speaking of access to care, I know we've brought a surgeon in, is that correct?
That is correct. We were without a general surgeon, which is a key specialist, for over a year. So we have Dr. Amin Sharifi, we call him Dr. A. He's joined our team, and we're thrilled to have him up here and offer those services again. In addition to that, we've added Dr. Rachel Kiesling to our primary care clinic. She's actually from Woodland Park. So she's so excited to be back and to be able to offer services in our community. We're currently recruiting another primary care physician to join her in the practice. And then we're also looking at adding an OBGYN.
Up here in Woodland Park?
Up here. Mm-hmm. So
that's amazing. Does that mean we'll actually deliver babies up here?
No.
Okay.
No, we will still do the delivery down the hill, but for all your prenatal visits, any GYN care, if there are GYN surgeries, we're equipped to do all of that.
So we'll have all those services here. And I know with Dr. Kiesling, I just learned recently that one of our volunteers at the Chamber actually babysat Miss Kiesling, Dr. Kiesling, when she was little. It was so cool.
Oh my gosh, that's funny, yes.
But it is so nice to have somebody local, to have them here. I know how excited you've been about local services coming here. Did I hear you mention at some point we may be looking at offering services to those going through cancer treatments?
Absolutely. We are also looking at the chemo and infusion, both cancer and non-cancer infusions. We want to expand that service. And I know that's so important to folks up here because you don't feel well, and when you have to make that drive down to the Springs, it's hard. So the more we can offer services up here, that's the mission that we want to fulfill.
So if I were to ask you, what do you believe is one of the strongest things that UCHealth brings to not only Woodland Park, but Teller County, Park County, our region?
Being part of such a large system with such comprehensive list of services and experts, it has really taken the levels of medical care to a new height here in our region. We have one medical record. So wherever you go in the system and whatever specialist you see, it makes the coordination of care so much easier for the physicians. It's even to the point where as a patient you can get on and you can see your lab results, you can dialogue with your physician online. There's just so much more that we can do being part of a local system, and especially one like UCHealth that has so many different services. We have the same ED physician group that they have down at Memorial Central, all board certified ED physicians, and that's a level 1 trauma center. We have the same group that rotates up. We saw over 8,000 ED visits last year.
Up here in Woodland Park?
Up here in Woodland Park.
Wow, that's amazing. That is amazing. technology is going to kill me. That'll be the death of me. Trying to learn all these new things. But technology is what we look to in healthcare. Can you share with us what UC Health offers in technology?
UC Health is so innovative. It's so exciting, some of the things that we've got coming up. For example, we talked about the chemo and bringing that up here. One of the really cool things UC Health is doing is they let the chemo patients do virtual reality when they're having their chemo treatment. So you can be totally distracted and go to the beach, go to the mountains, go on a cruise. It's incredible.
Really?
Yeah, it's very exciting, some of the things. Also now, when you try to call for an appointment with your doctor, you go into, phone death. Now you don't have to do that. It's almost like the, open table. You can go in and book your appointment online.
Just like dining reservations.
Exactly. It's
How
just
cool
like
is
that. So UC Health has a lot of innovative ideas, and their use of technology is really impressive. It's really going to make things better for our patients.
That's so important up here, and to let our residents know that they have the cutting edge here in Teller County, Woodland Park, that you would have anywhere else.
Absolutely.
Well, Kim, to close out this evening, what does it mean to UC Health to be named through the Chamber as our large nonprofit of the year?
Oh my gosh, Debbie, it's such an honor. It really is just amazing. We have such a dedicated team. They are just, it's a unique team. It's like a family, and they just are so committed to caring for our community. So I want to accept the award and thank you on behalf of each and every member of our team.
We are so thrilled, so fortunate. It's one of the questions we get asked a lot from people who are looking to relocate here. Do you have medical services? Do you have hospital services? So congratulations to UC Health, and we look forward to bigger and better things with your organization.
Absolutely. Thank you.
Thank you.